All right, so what we've got here is the patient's come in for routine treatment and asked me to check out a painful little lump under the foot. So as usual, you can have a look at it and it looks like a callus, but there may be something a little bit more sinister underneath. So we'll get in there and just take a look and see what's under the skin. And we're a little bit suspicious based on the patient's history that this might be a corn. So as we're debriding this, we're just looking for any central hard section of corn. So that will explain why they're getting such a pain. So they usually describe a rock or a stone sort of feeling in their foot that's a lot more painful on weight bearing, particularly on hard floors or for long amounts of time. So basically we go ahead, remove the overlying callus. Now this one turned out to be quite an interesting one because you can see as we go deeper under the callus here, you can see we've taken off the callus cap, but then there's another layer of corn underneath there. And it's actually quite similar colour to the regular overlying skin, so it's a little bit difficult to see this one, but as we cut and feel around there with the scalpel, you can see that it's actually got this really hardened central section. And I'll just see if we can get it all out in mostly in one piece so we can show it to the camera. That it's not always what they appear. Sometimes you need to actually use your thumb to feel where the actual corn is, and then you can actually see the edge that you need to cut along, but it's not always as easy as it would appear in the textbook. So basically we just go in here, keep removing that out, making sure not to hurt the patient. That's come out mostly in one piece, so that'll be about 95% of that corn, but it's a lot deeper and a lot wider than what it actually first appeared. We'll just give a bit of a close-up on that so we can see the where it's come out of. There's just a tiny little touch in there we need to get out and smooth that over. But if we take a look at that, you can see that the hole's much bigger than what it appeared and much deeper than what we first thought. So that would be the reason for this patient's pain in that location, and that's how we remove a corn.